This presentation is about diagnostic cystoscopy and what you need to know to be prepared for the minor procedure. Indications for diagnostic cystoscopy: gross hematuria, which is blood in the urine that you can see; microscopic hematuria, which is blood seen in a urine under a microscope; lower urinary tract symptoms that may need intervention; urinary retention; history of bladder cancer; bladder stones; recurrent infections; burning or discomfort with urination. Where is this procedure performed? The procedure usually is performed in your urologist's office or in an ambulatory surgery center. These are usually either adjacent to your urologist's office or in close proximity. These centers specifically are for outpatient procedures. Some patients may need their procedure performed in a hospital, usually due to medical conditions. What are the risks? This procedure is very safe. The risks may include infection, bleeding, injury to the bladder or prostate in men, or urethra. All of these are exceedingly rare. What does the procedure entail? The patient is brought into the procedure room and placed on the table. Most men usually lie flat, and most women are in a lithotomy position similar to a gynecologic exam. The urethra, the urine tube, is gently cleansed. Numbing jelly will be injected into the urethra. The urologist will then take a lighted telescope called the cystoscope and insert it via the urethra into the bladder. The doctor will inspect the urethra and the bladder in a woman, and in a man the urethra, the prostate, and then the bladder. Here's a depiction of this procedure. What is your doctor looking for? Bladder tumors, bladder stones, urethral scars or strictures, the degree to which the prostate is blocking the channel in a man, other findings including infection and inflammation. How long will this take? The procedure itself takes less than 5 minutes. Plan to arrive at least 30 minutes prior to your procedure. You do not usually need a ride home unless this is being done under anesthesia. How do I get scheduled? A surgical scheduler will give you a date. Usually this date will be within 2 to 3 weeks, as we need to obtain pre-authorization from your insurance company. Is there any special preparation? Not really. You can eat right up to the time of the procedure, and unless told otherwise, you do not need to stop blood thinners or aspirin. Pre-authorization. The pre-authorization process is essential. We will communicate with your insurance company to determine your coverage and any co-payments or deductibles that you may owe. We will provide you with an estimate of any charges that you may incur. All charges are due prior to the procedure. Payment plans can be arranged as well. Other urine-based tests that are associated with cystoscopy. Cytology. This looks for microscopic cancer cells in the urine. It is usually covered by insurance. FISH. Fluorescent in situ hybridization test. This looks for abnormal chromosomal changes that may suggest bladder cancer or other urinary tract cancers. This may or may not be covered by insurance. These tests may be ordered at the time of cystoscopy. We hope that your procedure goes well and that you have a speedy recovery. We appreciate your feedback regarding your procedure, as we are always trying to improve the care that we provide our patients. Should you have any questions regarding your procedure, please contact your urologist's office.